everyone. Today we wanted to share 3 of our favorite exercises for relieving plantar fasciitis. As we discussed in last week's video, plantar fasciitis is inflammation of the plantar fascia, a thick band of tissue running along the bottom of your foot, connecting your heel bone to your toes. This tissue supports your foot's arch and absorbs impact during movement. When irritated or inflamed, it can cause sharp heel pain, especially with those first few steps in the morning.
Stay tuned as we demonstrate some effective exercises to help plantar fasciitis. If you have any questions or you need some help with plantar fasciitis, feel free to give us a call, 785-842-7325. We are here to help. So with plantar fasciitis, we have to improve our ankle range of motion, and one of the exercises we like to use is a simple ankle dorsiflexion mobility exercise. So Dr. Amanda is going to demonstrate. We're using a box in this situation, but you can kneel down on the floor to do this as well. So 1 foot elevated, Dr. Amanda is going to push her knee forward over her toe, keeping the heel down. You can use your hand to kind of help keep that ankle down. You're going to just hold for 2 to 3 seconds, and then you're going to come back a little bit, take the pressure off, and ease back into it. You're going to do a set of 10 of these. You'll do 2 sets. If you have good enough mobility through it, you can also kind of drop down into that stretch a little bit more, getting more range of motion through the ankle. The better our ankle moves, the less our plantar fascia has to work and can help us have a stronger foot. Okay, for plantar fasciitis, we got to have strong toes so that we can have strong feet and healthy ankles, knees, hips, all the way up. So we're going to do some toe yoga today with Dr. Amanda. So we're going to zoom in here on the toes, and really what we're working here is our big toe range of motion, but we're going to of course use all of them at the same time. So we're going to elevate our big toes, and we'll hold them up for 1 to 2 seconds. Then the big toes go down, pressing the rest of our toes up in the air, holding for 1 to 2 seconds. And you're going to do 10 of these in each direction. You're going to do 3 sets daily. And don't worry if you don't feel like you have the ability to move your toes like this. Practice makes perfect. You can also, you can hold down your foot and raise the toe manually if you need to, and just kind of keep working it. The important part is that we're working range of motion into those toes. All right, the last exercise we want to show you that we use sometimes for plantar fasciitis is what we call big toe calf raises. So you can use a towel at home. You can do kind of a real soft pad on the floor, anything that you can kind of prop your toes up on this. And you're going to prop your toes up on this pad, just like Dr. Amanda is doing here. And in that position, you're going to do a calf raise. So you're going to press up through the toes, getting those calves, squeezing the calves up there, extending the toes. You're going to hold just for a couple seconds and then come back down. You're going to do 15 to 20 of these reps, and you're going to do 3 sets of them daily.
The big thing here is to make sure when you're coming up to really drive through your big toes and not let your feet roll out to the baby toes.
Yeah, so keep those big toes down and really put the pressure there on the big toe.